A lot of patients, they really don't understand how your oral health is directly connected to your overall health. I tell my patients that dentists are like detectives, because we can look in a patient's mouth. If they have a fiery red tongue, we know they're anemic. Some patients may say, you know, I have a metallic taste, so doc, what is that? I refer them to their internist, because that means that they have kidney disease. So sometimes we're the first to diagnose a lot of things. Even with oral cancer, we do on every patient, we do oral cancer screenings, because with oral cancer, you know, the biggest thing in dentistry is squamous cell carcinoma, and a lot of times there's no pain or anything. It might be a lump or a bump, or it could be just a white patch. So if we identify any of those things, we are going to refer you to an oral surgeon, you know, so they can take a look at that. But it's so important to get your teeth cleaned every 6 months or as often as your dental provider requests, because it has been proven that the same plaque that builds up on your teeth, it travels through the bloodstream, and that's the same plaque that gets clogged in the arteries of the heart and causes heart attacks. So when people don't get their teeth cleaned, you know, it can affect low birth weight babies, diabetics, and they have chronic infections. It's just a whole lot of things that can happen. So it is definitely a connection between your oral health and your overall health. And here at Aesthetic Dental, we try to treat both and try to educate our patients so they will know more about it. Because a lot of patients ask, well, Dr. Hines, do I have to floss my teeth? I say, you really don't have to. Just floss the teeth you want to keep, because I can guarantee you within 10 years, they will be gone, so you have to worry about it.